Hello and welcome to this lecture, which will give an overview of the process of developing public and community health initiatives. At the end of the lecture, you should be able to discuss the elements of program planning and implementation, explain how objectives are used in program planning, describe the theory of change of a program, develop a logic model, and explain the role of stakeholders in program implementation. Program development and implementation is the process of changing people, conditions, and environments to improve population health outcomes. Although priorities for intervening with programs or policy initiatives are identified during the community assessment, guidance for focusing the initiative and identifying targets for intervention may be found in the list of national and international goals and objectives. For example, the Healthy People Initiative is designed to guide national health promotion and disease prevention efforts to improve the health of the nation. Released by the United States Department of Health and Human Services every decade since 1980, the Healthy People identifies science-based objectives with targets to monitor progress and motivate and focus action. Healthy People has established benchmarks in order to identify nationwide health improvement priorities, increase public awareness and understanding of the determinants of health, disease, and disability, and the opportunities for progress, provide measurable objectives and goals and that are applicable at the national, state, and local levels, engage multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge, and to identify critical research, evaluation, and data collection needs. And so the Healthy People 2030 is the fifth iteration of the initiative and continues in this tradition with about 350 core objectives and to be tracked over the decade. Similarly, the Sustainable Development Goals (SDGs) of the United Nations include 17 goals and 169 targets, and most of which are directly or indirectly related to health and to be met by the year 2030. So, selection of the program and policy initiatives to be implemented is also influenced by the multiple factors that reflect the organization's overall mission. And the organization's mission provides the direction for program planning and implementation. So, in a hypothetical example, we could say that high rates of diabetes in a community led to the development of an initiative to prevent the onset of diabetes in those at risk of the disease. And the community assessment found that those most likely to have diabetes were Black and female and had not completed high school. In addition, it found that among those between the ages of 45 and 64, and the number of new cases of diabetes was 6.9 per 1,000, a significantly higher value than that of the 18 to 44-year-olds, whose rate was 2 per 1,000. Rates were even higher among those 65 years and older. An additional finding was that women were more likely to be obese than men, and the community decided to tackle the problem by developing a diabetes prevention initiative. So, embedded within this information are a number of facts that would influence one or more organizations to develop program or policy initiatives. The organizations most likely to take on the task of reducing the rate of diabetes in this population would likely have missions that encompass this population group and would have the capacity to effect the needed change. So in this lecture, we'll discuss the development of public health interventions as a prelude to program evaluation. The mission of an organization is reflected in its mission statement and mirrors the organization's charge, the direction of the organization, and the population focus. So it is the foundation for the planning process and the development of goals, objectives, and activities to address public health problems. So the mission statement announces the public health problem that the organization wishes to address and in the broadest perspective. So a strong mission statement for an organization contains three some components and such as the desired outcome of the programs, the population that will be the target of its work, and the geographical and community that will be served. So an example of an organization's mission statement could be to improve the quality of life of African American women in Bannock County. Another organization's mission could be to reduce the rates of chronic diseases among women who live in the state of Idaho. So both organizations could use their missions to address the high rates of diabetes among Black low-income females. However, each organization might take a different approach to achieving the same goal. For example, one organization might choose to provide increased access to healthcare to improve treatments and opportunities for treatment and for those with diabetes. And another organization might focus on the prevention of the onset of diabetes. So, irrespective of the approach that is taken, the next step in the process will be planning and implementing the initiative. So, developing a good plan for an initiative starts with building community support. The, the social, political, and cultural environment of the community provides a context for the organization's programs and policy initiatives. These factors determine the types of programs that the organization offers, its funding level, and community support for its initiatives. So, community support influences initiatives and development and implementation in many ways. When a community-based organization or an agency identifies a problem and develops a program, its ability to sustain the program is often influenced by social, political, and cultural factors in the community. So the social and political factors influence people's attitudes toward population groups and causes. And when support for addressing the problem is high, programs are able to attract attention from many sectors and obtain adequate funding for program development and recruit participants. However, when support is low, the organization may have difficulty securing sufficient funding, and members of the community may not use its services or participate in its activities. So, good examples of initiatives whose development is often limited because of low community support and probably based on a combination of social and political factors are providing community-based care for people with behavioral disabilities and providing shelter for the homeless. So community support provides evidence for potential funders that the program is well accepted by the community. It ensures the credibility of the organization and demonstrates that community members believe that the initiative is making a difference. Um, in addition, community support is critical for the development of coalitions and to provide programs and policies. And conversely, a lack of support from key individuals and organizations or sectors of the community works against the organization and influences the public's perception of an issue and the organization's approaches. It is therefore important to solicit the support of influential community members, other organizations that do similar or complementary work, and people who are directly affected by the issue, and organizations and agencies that provide a voice for the community, such as advocates and media outlets. Political leaders are also important stakeholders in the development of programs and the funding of initiatives. So a well-designed initiative developed to address a particular public health issue uses community and epidemiological data to guide the development of goals and objectives, which are achieved through evidence-based and theoretically sound activities and supported by strong administrative capacity. Another requirement in the planning of an initiative is the provision of administrative support. Strong administrative capacity is important for developing and delivering quality programs. Administrative capacity influences the type of programs and the size and scope of program activities. Administrative capacity for program delivery includes having physical structures, oversight, and staffing to ensure adequate and appropriate program implementation. It thus includes the physical structures that house the initiatives, components, managers, including board members, staff, outreach personnel, and volunteers, program operations and activities for each initiative, equipment and supplies that are suitable for program implementation, ability to address challenges posed by the initiative, and so on. So, planning an initiative also entails the use of community assessment and epidemiological data. The community assessment and epidemiological data are used in determining the direction of the public health program or policy initiative. They provide a fact-based rationale for the intervention and define the populations that, if targeted for the intervention, would benefit the most. Furthermore, the data used at the start of the program can form the baseline against which the proposed intervention outcomes can be assessed later on. Community assessments and epidemiological data contained within reports and the literature review provide information that helps in developing a detailed plan for the initiative. And this information includes the health problem, prevalence and incidence of the disease, and the quality of life indicators, and the risk and protective factors that influence the behavior of individuals, and the social, cultural, and political factors that reinforce or enable conditions that increase the public health problem, and assets and resources available within the community. So next we look at goals and objectives. Developing sound initiatives requires having or coming up with goals and objectives. Unlike the mission statement, which is broad, goals provide clear direction and objectives provide specific benchmarks for the initiative. Objectives serve as the benchmarks for determining the level of implementation of the initiative, and its outcomes. So, as mentioned, as we have already mentioned, the Healthy People 2030 and the Sustainable Development Goals documents provide guidance for identifying specific targets for an intervention. Um, Going back to our previous example of diabetes, Healthy People 2030 has 15 diabetes related objectives, and each can be used to develop activities, and together they form the initiative to address the problem. So the initiative goal closely matches the mission of the organization and relates to the particular public health problem that is being addressed. And the goal provides the initiative direction and is a stated desire to meet an expressed and unmet population need. It is made up of three elements: a description of who will be affected by the program or policy initiative, the intentions of the program, and specific broad changes that will occur as a result of the initiative. If the mission of the organization is, for example, to improve the health of women who live in Idaho State, then the goal of the initiative may be to reduce the rates of diabetes among and improve the quality of life for low income African American women in Bannock County. In analyzing this goal, and we realize that it contains all the components of a goal, namely, it describes who will be affected by the program as low income African American women in Bannock County. It communicates the intentions of the program, which is to develop prevention of policy initiatives that target the risk and protective factors that influence the rates of diabetes. And it specifies broad changes that will occur as a result of the initiative, which is reduced rates of diabetes and improved quality of life. The program goal reflects the initiative goal, but is written in a way that is more specific. So the program goal identifies who benefits from the program, the help and the health benefits they will receive, and when the benefits will be achieved. So, for example, if the program goal is to reduce the proportion of low income African American women who get diabetes, from 30% to 10% by the year 2030-35, the people who benefit are low income African American women. They receive as a benefit a reduction in the prevalence of diabetes from 30% to 10%, and this benefit will be achieved by 2035. Um, the initiative objectives are developed to support the program goal. The objectives outline the initiative's precise direction and define its planned purposes. Objectives provide small steps or benchmarks, so to speak, that, if completed, will achieve the goal. They define specifically the road to success. They provide part of the blueprint for program replication, and they provide the short, medium, or long-term the benchmarks of the program's implementation. They're also like sort of a guidance for developing the activities of that program, and they provide guidance for program evaluation. So, because the objectives are an important aspect of evaluation, as they are used to specify its focus, they must be consistent with the organization's mission and the initiative goal, and they must be realizable during the life and the funding of that program. So, well developed objectives are defined as being specific, measurable, achievable, relevant, and time bound, So a useful acronym, um, which I believe most of you must have heard before now, for developing objectives and remembering their attributes is SMART, SMART. So let us consider what each of these terms means. Specific and helps us answer the question, and does the objective clearly specify what will be accomplished? Mm. For measurable, the attribute of being measurable, we're interested in asking the question, are the changes that are specified to occur measurable in appropriate and culturally sensitive ways? Achievable, or some others call it realistic, and ask the question, are the changes attainable given the time frame, the population, the resources, and the experiences of the organization? And then relevant, which is also referred to by some authors as appropriate, and asks, do the changes that are to occur for the participants or in the environment make sense, given what the intervention is trying to accomplish? And then time bound, it means that the objectives have to be accomplished within the specified time frame. So there has to be a specified time frame for accomplishing those specific objectives. So here we see a diagrammatic representation of the hierarchical relationship of goals and objectives. As we have mentioned, unlike the mission statement, which is broad, goals provide clear direction, and objectives provide specific benchmarks for the initiative. So there are two kinds of um, initiative objectives: outcome objectives and activity objectives. The outcome objectives are written to guide the achievement of a program goal, and they are important for assessing progress and the ultimate success of the initiative. So specific outcome objective indicates what is going to change and by how much it is going to change. We can learn a number of things from this hypothetical objective, which is to increase the proportion of low income African American women who consume 5 portions of fruits and vegetables a day from 30% to 60% by 2030. So first we can see that the program developers intend to provide an intervention that will result in participants increasing their consumption of fruits and vegetables. Second, we see that they expect that the proportion of women in their program who consume fruits and vegetables will increase to 60%. And then thirdly, we see that the baseline that the program is using against which they will assess the progress is a current proportion of 30%. So in general, a specific objective contains the expected outcome against which the effectiveness of the organization will be measured. In this case, the expected outcome is that women who participate in intervention will consume 5 portions of fruits and vegetables a day by 2030. And this provides an intermediate benchmark to reducing the proportion of women who get diabetes by 2035. The objectives set the stage for the level of intensity of a program. The intensity of a program determines the likelihood of it being able to accomplish the goals and objectives. And so the higher the targets, the more intense the program needs to be. In the hypothetical program we are using, if the program is of low intensity, the initiative may get the prevalence of diabetes down to only 20% rather than 10%. To give another example, an educational intervention that only provides information to change knowledge is likely to do that fairly easily. So expecting 90% of the participants to increase their knowledge of, and let us say, the roots of HIV transmission is realistic even after a 3-hour session. This objective could read: by the end of the training, 90% of participants will be able to explain all the roots of HIV/AIDS and HIV transmission. However, specifying a change in behavior with regard to preventing HIV transmission would require a more intense intervention for a longer time and with a lower likelihood of success. So the targets would have to be lower, and such an objective could be appropriately stated as: by the end of the year, and 40% of program participants will stop using non-sterile needles or other instruments. So behavior change to improve health outcomes is influenced by multiple risk factors. These are characteristics that we attempt to modify in order to achieve the behavior change. And these factors occur in the individual and in the environment in which the individual lives and works and plays. So at the individual level, we're looking at factors such as intellectual ability, beliefs, values, and skills, maturity, and health. At the interpersonal level, it's concerned with the relationship an individual has with family, peers, and significant others. The organizational level encompasses the resources and the support, the goods and services that are provided by an organization or institution. And the community level includes societal norms, social networks, and social capital, and access to goods and services. And at the public policy level, we're interested in laws and regulations that support or discourage healthy behaviors and access to goods and services. So changes in risk factors may include increasing knowledge, changing peer norms, and improving physical structures to increase the likelihood of eating in a healthy way or of exercising. Changes in behavior may include increasing physical activity, eating healthier foods, obtaining health care, and enacting healthy and health oriented policy, good health oriented policies. And to be measurable, outcome objectives should incorporate verbs that are action oriented and can be assessed using available measurement tools. And so outcomes are measured using surveys, observations, and interviews, and photography, and so on. And verbs such as understand and appreciate are difficult to measure and using such tools. So writing a specific measurable outcome and objective goals and goes hand in hand with writing a realistic objective and that has a specified time frame and the time it should take to accomplish that objective. So timelines reflect a progression from achieving objectives easily and to achieving them with difficulty. For example, changing knowledge is fairly simple and can often be done in a single session. But changing behavior or enacting legislation may take many and varied activities and great efforts will be required to accomplish it. So objectives are short, medium, and long term. And consider a time frame of 10 years. And short-term objectives will fall within the first 1 or 2 years. Intermediate objectives will be between 2 and 5 years, and then long-term objectives from 6 to 10 years. Objectives that focus on the individual level and on knowledge gain as the outcome are generally short-term and limited in reaching overall goals. And skill building objectives are generally short to medium term, and then behavioral change objectives are medium to long term. Objectives that are at the interpersonal, organizational, or community level may also have different periods of time and depending on the outcome expected. And for example, changing community norms or improving access to resources may require short, medium, and long-term outcome objectives that provide benchmarks for change over an extended period. Policy outcome objectives are usually written for the longest time frames because they require a considerable amount of effort. Changing policy first requires increasing knowledge and understanding of the need for that policy. So the first step leads to the development of coalitions and advocacy, and the actions of the coalitions lead to procedures for the development or change of a policy. And only after these steps is the policy enacted. And the time it takes to enact a policy will depend on the type of policy, the level at which it is enacted, whether local, state, or national, and the policy and the political climate. So, in adopting the ecological model for addressing a public health problem, an organization chooses to develop initiatives at multiple levels. And the more levels that are included in initiative, the more likely the health problem will be addressed from a holistic perspective and take into account not only individual factors, but also, for example, peer influences on community norms and services, organizational structure and functioning, and local or national public policy. So while there are a small number of outcome objectives, there are many activity objectives that are directed toward achieving each outcome objective. And the activity objectives specify the activities for carrying out the initiative. And together, the objectives and the activities are the blueprint for replication of the initiative. And ultimately, it is the activities in the initiative that results in the outcome specified. So activity objectives are the most frequently written objectives and the most familiar because they specify organizational and administrative tasks. The activity objectives guide the implementation of the initiative and become the process objectives during the evaluation. They are used to monitor and evaluate the initiative's level of implementation and progress. So activity initiatives should answer these questions. What activity will be carried out to support the outcome objective? And who will conduct the activity? When will the activity be carried out? And then where will the activity occur? Mm. So for this course and your assignments, and when we use the term objectives, and we'll be referring more or essentially to the activity objectives. So please keep this in mind. This table provides examples of action-oriented verbs for writing objectives. So when we're interested in the outcome of knowledge, increasing knowledge, we can use such terms as demonstrate, predict, evaluate. And when it's about attitudes, the words choose, communicate, and practice are examples of verbs and that can be used. Here we see more examples of activity objectives. So the first could be fitness staff will conduct a 3-day interactive educational and skill building workshop, and we're starting on day one of the regime cycling intervention in the gym. And 30 women 40 to 60 years old will participate in the 90-day regime cycling intervention in the gym. And women 40 to 60 years old will identify a body to work with for 45 minutes each day. And volunteers from the regime will provide information and outreach activities in the community surrounding the gym for 60 days before the start of the regime cycling intervention to raise awareness of the importance of exercise for cardiac health. The initiative activities are the approaches for achieving the objectives. For example, it is well recognized that to reduce obesity, both healthy eating and exercise are required. Um, so initiatives and the activities are developed to address both. Activities are based on a number of factors, including the demographic characteristics of the beneficiaries of the initiative, and the risk and protective factors involved, and the human, financial, and material resources that are available. So, ideas about the most appropriate approaches for achieving an outcome can be gotten from conducting a review of the research literature, identifying theory driven programs that address the same or similar issues, identifying evidence based best practice models, conducting or consulting with local, states, and national organizations and experts who are doing similar work. So the activities must be appropriate for achieving the objective. For example, if the objective is to improve the skills of young people to perform a certain task, and then the activities that are identified must provide skill building opportunities so that the youth learn and then practice the skill and to proficiency. Likewise, if the outcome objective is to enact a policy, then the activities that are undertaken must clearly and logically lead to involvement and actions by policymakers. Mm. Activities to change policy may include education to change knowledge, beliefs, and attitudes, advocacy to increase understanding and relevance of the intended policy, media communications to expand the reach of the message and to change public opinions and perceptions about the issue, and message development to target the message for particular groups, training to develop a cadre of advocates and message champions and new leaders, and outreach to increase the volunteer core, and meetings with policymakers to facilitate increased ownership of the issue, and development of information sheets and briefs, and building the capacity of the organization to handle the work, which may entail increasing staff, technology, infrastructure, and conducting more staff development. So overall, appropriate activities have certain characteristics. And number one, they are likely to lead to change that is specified in the objective. And secondly, they can be completed during the specified time frame. And thirdly, they are conducted by an organization that has sufficient resources and personnel. Furthermore, they are appropriate given the culture and expectations of the population and for whom they are intended. Next, they form part of an overall plan to achieve a program's goal. So activity um, should preferably be based on established public health theory-based approaches that have been shown to have an effect on risk and protective factors. And any theories that have been used as part of the community assessment should be used to frame the activities for the initiative. And there is a greater likelihood of incorporating all the factors that are known to result in a given change if the activities are based on theoretical constructs than if they are not. So, an alternative to developing initiatives from scratch is to identify and adopt already tested evidence based programs that have proven to be effective. An evidence based program is based on the most rigorous scientific evidence through a well designed intervention research study that is often supported by both qualitative and quantitative data. Mm, The evidence-based initiative selected for adoption should relate to the needs of the project and have similar goals and objectives. Certain characteristics are associated with evidence-based initiatives. They specify the population that intervention was tested with, and they are based on research conducted using experimental or quasi-experimental designs and with control groups. And they identify the specific effects of the intervention on those who received the intervention compared with those who were in the control group. And they provide sufficient information that will enable replication. And so evidence-based interventions are now recommended in clinical and prevention programs in medicine, social work, and public health. For example, the Substance Abuse and Mental Health Services Association hosts the National Registry of Evidence-Based Programs and Practices, which contains a searchable database of over 130 substance abuse and mental health related interventions. Also, the Centers for Disease Control and Prevention, CDC, developed the Tiers of Evidence conceptual framework, which provides a system for classifying behavioral interventions and based on the level of evidence for reducing the risk of HIV. And the system has four distinct tiers. Tier 1 and Tier 2 interventions are those classified as evidence-based, and Tier 3 and 4 consist of behavioral and theory-based interventions. And so the system is based on the quality and the rigor of the studies of an intervention and the strength of the findings. And so Tier 1 interventions are the most vigorously evaluated, while tier 4 includes programs with the least amount of empirical evidence. Sources of information regarding evidence-based and theory-based programs and principles that reduce the risk of a disease or disability includes published articles and reports available on the internet or in libraries, and reports from or consultation with local, state, national, and international organizations, and independent private and public research institutions, and public health practitioners. It is important to think critically about adopting evidence-based interventions, and because they may be developed for a population that is different from your own. So questions to consider in determining whether an existing program can be adopted for your population includes what changes does the program target? Are these the same as those for the intervention being considered? Does the intervention serve a population with the same or similar characteristics? Are the appropriate resources available to implement the initiative? Can the initiative be implemented as described by the developers of the intervention? Are the intervention activities and delivery mechanisms culturally appropriate? Um, so irrespective of the approach used for developing the initiative, it is important to demonstrate a clear and logical relationship among the mission and the goals, objectives, and activities in the program's theory of change, and that is its operational theory. So the theory of change is the theoretical foundation of the initiative, and it explains what the organization is hoping to achieve with the initiative, and the rationale for the program, and the program's goals, objectives, and activities. It describes how the resources and activities lead to attaining initiative objectives and goals. It is best developed by working with the stakeholders. And it is important to consider the cultural context of the initiative and how it is represented in the theoretical perspectives. The logic model is a graphical or pictorial depiction of a program's theory of change. Mm. The only requirement for a logic model is that it is to tell the story of the intervention in a condensed and understandable format. So a logic model is a way to map a program during the planning or evaluation phase. And it's a way to show the program developers chain of reasoning and to provide a process for understanding the program's activities and how they are linked to the outcomes. A logic model is a tool to facilitate the stakeholder insights and reflection. It's a tool to inform monitoring and the development of benchmarks and to focus the evaluation. We can also say it's a tool to help others understand the thinking of the program developers. So an alternative use of the logic model may be managing the project through a depiction of the activities and the implementation. So the logic model shows diagrammatically the initiative's basic components and the resources, the activities, the outputs, and the outcomes. And to keep the purpose of the program in full view, and the program goal is noted at the top of the logic model. And if you wish, you could also include the public health goal and the outcome objectives. In addition, the logic model identifies the points at which the process evaluation activities are important. The logic model should include certain components, and like as we have mentioned earlier. And number one is the resources, and sometimes called inputs. And these are the human, financial, and material resources that are used for the initiative. And they include staff and other personnel who will be available to work on the program, and grants and other monies allocated for the program, as well as office space and training materials and other resources that are provided for the initiative. Next is the program activities, the specific activities that participants take part in or are exposed to that will result in changes in the participants. Examples of the activities are workshops, training sessions, educational outreach programs, coalition building events, policy framing, and advocacy. Then there are the outputs, the initial products of the initiative, and that is the results of the intervention. Examples of outputs are the number of people trained, number of pieces of materials distributed, the number of media spots provided, the number of legislative drafts written. The next component is outcomes, and these are the expected short to medium term effects of the intervention. And there are changes that occur in the participants of your program. Examples of outcomes are increase in knowledge, change in attitudes, change in behavior, increased satisfaction with social support, increased social networks, increased access to healthcare, and passing a policy or legislation. The final component is the impact, which is the expected long-term effects of the program or a policy initiative, such as the improved resilience of participants and change in the health status of the target population or change in the status of the health system. So as we noted in the introductory lecture, the use of the words outcome and impact is one of the major areas where terminology is inconsistent. And for example, some authors do not use impact, but have three categories of outcomes: short-term, immediate term, and long-term outcomes. And here, the long-term outcomes will be equivalent to impact. But for this course, I would prefer that we stick to outcome and impact as I've defined them. There are criteria for a good logic model. A well-developed logic model may be used as a tool throughout the iterative process of the program planning and is useful if it is detailed and yet not overwhelming, and contains crucial elements of the intervention. And if it clearly shows the relationship among the program inputs, outputs, and outcomes, and if it is understood by stakeholders, if it's complementary to other management materials. And note that an initiative may have more than one logic model. In order to solve public health problems, initiatives for tackling these problems must be effective, and successful initiatives meet key criteria. Number one, they are comprehensive and address multiple risk factors and social determinants of health while recognizing and strengthening protective factors. And they address the needs of the population specifically and are culturally sensitive and appropriate. And they are sustained over a long period, and they address problems that concern the community and which supports finding solutions. They have well-trained managed staff, and they are well resourced. And so effective programs have certain characteristics. Activities are appropriate for accomplishing the objectives. Human, material, and financial resources are adequate. Activities reflect cultural sensitivity, and the staff are trained and adequately prepared to deliver and support the initiative. And a clearly articulated timeline for implementing the initiative is followed. And barriers to program implementation are recognized and solutions identified. Effective strategies to market the program and recruit participants are well utilized. And monitoring and evaluation data collection tools are developed and utilized to assess program implementation and outcomes. In addition, developing appropriate and effective initiatives to address public health problems requires input from a range of stakeholders. A critical stakeholder in the initiation of the program or policy initiative is the funder. And the funder provides the resources for the program and many times oversight, often as a member of the board of directors. Other stakeholders include those who provide oversight and those who benefit from the program. The development of culturally appropriate and sustainable programs that lead to empowerment requires the establishment of effective partnerships with all stakeholders. And the partnerships are strengthened by the participation of stakeholders in multiple tasks, including reviewing the community assessment, developing the mission, goals, and objectives, identifying appropriate theories, theory-based initiatives, and evidence-based programs, identifying activities for program implementation, designing a program, and developing the program's theory of change, identifying resources, human, financial, and material for program implementation, initiating and overseeing program implementation, developing an evaluation plan, and identifying an evaluator. So in summary, the mission statement reflects the organization's mission, direction, and population focus. The initiative is developed based on the findings of the community assessment, the mission, and the social, political, and cultural contexts in which the program operates. And outcome objectives provide benchmarks for the achievement of the program goal. And these objectives frame the initiative in multiple domains: individual, interpersonal, organizational, community, and public policy. And well-developed outcome and activity objectives serve as tools in evaluation. And initiatives include theory-based or evidence-based programs, and logic models and depict the theory of change of an initiative in graphic or pictorial terms. And the logic model informs the monitoring of the initiative and focuses the evaluation. And components of a logic model are resources, activities, outputs, outcomes, and impact. See you in the next lecture.